Hello. Hello, my hospice family. Oh God, let me see how my lighting is. Try to fix this light for y'all. My light does not want to cooperate. I don't know how to put it, guys. I want y'all to be able to see me. Ah. Okay, like, why couldn't I have done this before the live? Like, why am I doing this now when I am live? I'll get it. One of these days, guys, I promise you, I will get it. I should have done this before, y'all. Apologize. Apologies. Apologies. Apologize. Now it looks too dark, doesn't it? And I don't want to stop this. Does it look okay, y'all? I feel like this way is like too much in my face. Come on in, my beautiful people, while I try to do this light. Okay, so we may have to just stay like this, okay, y'all? Apologies. But we're in the dark. And my lighting, I don't have those like rings, you know. I used to, but I don't have it. So too bad. Too bad, too sad, like my son will say. He's like, too bad, too sad. Come on in, my hospice family. Where are y'all? No, that's not gonna work at all. All right, we'll just leave it like that, okay? Maybe I should have gone downstairs. Yeah, I should have done this video downstairs, right, guys? Oh, well. Next time I'll know, because downstairs I have more light. In my office, I don't have much light. Good evening, my hospice family. Please be sure to say hi. Say hi as you come on in. Hi, good evening, good afternoon. Welcome to DunsHospice. My name is Nurse Dawn. I am your hospice registered nurse. Hello, guys. Yes, I love it when you guys come out and talk to me. Please come and talk. Introduce yourself. Let me know where you're from. Okay, where you are watching from. Please. Hi, Freya. Good evening, girl. Good evening, Freya. How you doing? Welcome to DunsHospice. I hope you are part of the family. If not, be sure to subscribe, okay, guys? Subscribe. This channel is for you, the caregivers, all right? Hi, Dennis. Hello, Dennis. How you doing this evening, Dennis? Thank you for being here with me. Oh, Freya, you are from Canada. Oh my God, you must be cold. You must be really cold, huh? I apologize. I know. Dennis, you're from Ghana? I've been to Kenya. Yeah, I spent some time in Kenya. Yes, I know Ghana. I went in college. I had some Ghanese friends. Ghanese friends, yes. Oh, it's not that cold? Oh, okay. Well, that's good. I'm glad. Did you guys get snow over the weekend? How much snow did you get over the weekend? Yes, that was definitely amazing, Dennis. Okay, guys, so please, if you have not done so, subscribe to be part of the family. We are going to talk about hospice, end of life, Ghanaians. Thank you for correcting me. I am learning something new, Ghanaian. You guys, of course, the video stopped. Sometimes it happens, y'all. I apologize. The video stopped. My connection went away, y'all. Come back, come back. Okay, so we are going to talk about, this is actually part two. The other day I made a video. It was part one, um, regarding how hospice provides us with peace. Okay, so this one is going to be part two regarding how hospice provides us with peace. So in the first video, my beautiful caregivers, if you have not done so, go back to check it out. Okay, the first video I talked about, hospice give us peace in terms of, you get a nurse. Okay, you get a nurse like myself 24/7. All right, so if you have a question, if you know something is wrong with your family, with your loved one, you could call hospice. Okay, you could, call, and then we will be right there. A hospice nurse will come to you. Hi, Zia. You from Indonesia? Oh my goodness. Tonight is an international night. I love it. Do you know that I was born in Haiti, guys? So I was born in Haiti, migrated to the USA at the age of 9. Okay. And then me and my family, we live up north in Boston, Massachusetts area. Okay. So yeah, so we are all from all over the world. I love it. I love it. Even though we're from all over the world, we are all one. All right. So keep that in mind, y'all. We're all one. We are all connected. Thanks to the internet. I love it. But yes, so like I was saying, so in the first video, I talked about how hospice is peace. Okay, hospice brings the family peace. It brings us peace in terms of, you have a nurse 24/7 that's available to you. If you have any questions, you just pick up the phone. We'll imagine that this is, the phone. Just pick up the phone and call your local hospice company. Call the local hospice company. Okay, the office, and you could have a nurse to come to visit you. All right, so that is so, so, so good. And the other thing that I mentioned regarding, the peace, is the fact that, hospice, um, we have things like medications, that's like right available to you. So it doesn't matter if it's a weekend or if it's a, holiday, we can deliver medication straight to your door. Hi, Dennis. Good morning. Where are you right now? Huh? It is nighttime where I'm at. I'm in the US. What country are you in? Wow, it's morning for you already? My goodness. It's already Wednesday. Wednesday the 28th. I love it. Let me know, Dines, where you are right now, because you already saying good morning. But yes, so the other thing that I want to talk to in regards, so now part two. Okay, so we're gonna get to part two. All right. So hospice provides you, the caregiver. Now, I'm assuming we all know about hospice. We all know about death and dying. We all know about end of life care, right? Perfect. Now, hospice, my family, it provides you with peace of mind because you're also going to get an aide, okay, like a hospice aide. And that person, that designated aide, is going to come to your home to help take care of your loved ones, meaning that, she or he I'm from up north, Dine, okay, in the US, Boston, Massachusetts. Where are you from? Hmm? Let me know. Thank you for being here. Yes. So, the aide, okay, the hospice aide will be able to come into your home and help take care of your mom or dad. Like she's going to help them to bathe, okay, to take a shower. India, yay! We are all over the world this evening, y'all. I love it. Yes. And like I said, Dine, I was born in Haiti, okay? I was born in Haiti in the Caribbeans. All right. All right, so then the hospice aide will be able to, take your mom or your dad or your loved one a bath, clean them up. Okay, she'll be able to teach you how to take care of your loved ones who's dying, at home. All right. And that is huge. And then sometimes too, one of the main things that families like, it's when the aide goes to the nursing home. Say you have a loved one who's at the nursing home and she doesn't like to eat. Okay, your loved one does not like to eat. So the aide can go straight to the nursing home, okay, and help to feed your loved ones. Okay, so then she could go during lunchtime and definitely help to feed, mom, dad, things of that nature. So people really, really, really love their hospice aides. Okay. You guys, the video stopped again a third time, so I think I'm gonna keep it short, and I hope it doesn't do that again. Oh my goodness. Stop. Anyhow, so yeah, so like I was saying, they love their hospice aides, okay? That's another way that you could get some peace is by having added support, like the aide, the social worker, we also have volunteers, we have like a whole team of people. So it's not just the nurse, it is a whole team of people. All right. So besides that, the other thing that brings you peace while you are under hospice care, okay, is the fact that hospice is free. When I say free, I mean that it delivers free equipments, all right, like such as hospital bed, in a wheelchair, okay, or a bedside table or a commode. I once met a family who was so amazed about the fact that the hospice company sent them a chair, like a wheelchair, the same day. And that family was telling me, the family said, oh my God, Nurse Dawn, it has been months, okay? It has been months since I've been trying to get a wheelchair for my dad, and it just was not happening, you know? Dine, I am a hospice registered nurse. I'm a registered nurse. Okay, that's what I do for a living. Right now, I'm a nurse. Okay, I'm also a consultant. I'm a nurse coach and a nurse consultant. All right. Yeah. So the family was amazed. The family's like, "Oh my God, Nurse Dawn! Like I've been trying to get my family." My dad this wheelchair forever. And then, the insurance company kept on giving them the runaround. Like the insurance company was basically telling them they couldn't do it, you see. But thank God, as soon as they enrolled the father, we were able to get him a wheelchair, and that was awesome. So hospice definitely does provide you, my caregivers, with equipments, okay, with equipments that really, really makes a difference, okay? So that's the other thing too that I wanted to talk about, because oftentimes these equipments like oxygen, a bed, a wheelchair, a commode, these things cost a lot of money. Okay, not only do they cost money, but sometimes the insurance, it requires a lot of authorization. You see, the insurance wants you to have a lot of authorization before they can give you these equipments. Whereas if you enroll under hospice care, if you enroll your loved ones under hospice care, they'll be able to get these equipments really quickly. All right. Oh, Marina says, got so much respect for you workers at hospice, helping them over to the other side. Yes, 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 Marina. Thank you so much. That is so true. Thank you so much. We appreciate you. We appreciate you. Um, yes, that is true, because it's not, like I said, it's not an easy career, okay? Being a hospice nurse, it's really emotional, because it's like meeting somebody and knowing that at any moment, they can die. But what I've always told people and told my fellow co-workers, anybody who asks me about like, how do I do this job? I focus on the good that I'm doing, because I've been a hospice nurse since 2012, okay, since 2012. And so I love it. And I always focus on me doing well, like, being able to keep the patient comfortable, me being able to educate the family, you see, just being able to um, fulfill their wishes, their last wish, because most of them wants to stay at home, wants to remain at home comfortably, with their loved ones, with their family. So they don't want to die in a cold hospital bed. You see what I mean? And so they want to be kept at home. And so myself as a hospice nurse and my team, we come into your home. We make sure that we manage your symptoms at end of life. Symptoms like, having pain. If you're having pain, we have medications like morphine that's really gonna help you. If you're having difficulty breathing, we could give you oxygen, like I was saying regarding the equipment. Are we back? Are we back, guys? I'm so sorry. My internet keeps on going off. Are we back? So we can give you things like morphine. We can give you things like oxygen, okay? We can give you, just a lot of support to make sure you are home. And when the patient dies, when your loved one dies at home, thank you, Dennis. Thank you, my dear. When the patient dies at home, we will come to your house. We'll come to your house and do the pronouncement. So you don't have to call the police. You don't have to call the EMT. You see, we'll call the funeral home for you. We will clean your loved ones. We will make sure that, they are nice and clean and presentable and ready to go. Okay? But my hospice family, that's what I wanted to say, okay? Because I actually have to go, because my internet keeps on going in and out, in and out. But please, if you have not done so, make sure you subscribe, okay, to this channel to be part of the family, all right? I call you guys my hospice family, my caregivers. Please, 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 okay? And also hit the notification bell so you'll know each time I am on live. I would love for you to come back and be with me. Marina says, what made you wanted to work as a hospice nurse? How was it the first time you helped a soul pass over? Bless. Wow, it's sort of a long story, Marina, but thank you for asking. Thank you for asking. So what made me wanted to become a hospice nurse, and I'll just make it kind of short. And I've talked about this in in one of my other videos. It's an old one, but one of the main reasons is because I was just curious. I was really curious because I started out my career as a floor nurse. Okay. I started out working in a rehab hospital. All right. I started out as a floor nurse in a rehab hospital. And so as a floor nurse, I would have some patients who were really critically ill, who were terminally ill. And so these patients, okay, were under hospice care. And I would see the hospice nurse coming in, and the hospice nurse would be in the room with the patient for like 30 minutes, for an hour. And me as a floor nurse, I had like 10 patients to my assignment, you see, and I was not able to give these patients that one-to-one dedication that the hospice nurse who came into the facility was giving them. And so I was just curious, Marina. I was like, well, who is this hospice nurse? Like, how come they could stay in a room with their patients for so long, and what's going on? And not only that, the family really trusted the hospice nurse. Anytime there was a medication change, anytime there was a change in condition, the family would always tell me to call the hospice nurse. The family would tell me, okay, as the floor nurse who's been with the patient almost all day, what does the hospice nurse say? What does the hospice nurse recommend? And so I really became curious, Marina. And so I would, ask the hospice nurse, like about their treatment plans, and just, just kind of ask questions, because I also felt like as a nurse, and you may know this too, as a nurse, when we work in a hospital setting, we don't have time to devote one-to-one with our patients, because we are in and out, in and out, in and out. But the hospice nurse really have that dedicated time to do one-to-one for a long period of time. And so that really touched my heart. And so basically, I first started out working as a hospice nurse just on the weekends. I would just pick up shifts here and there. But as I did it, I really loved it, because I really felt like I was doing something amazing in the caregiver's life. I was really helping, and I could really get to know my patients intimately. Like they were not just a number, or they were not just some, like a patient that I had to hurry up and give medications to, and then go to the next one and the next one. All right. And so I really enjoy taking my time and teach the family how to best take care of their loved ones in such a vulnerable time of their life. And so it's been, stuck with me ever since. It's very special. Like, hospice is one of those, nursing fields where you either want nothing to do with it or you love it. Yes, it was definitely, my calling. What do you do for work, Marina? Are you also in nurse too? Like, are you in the medical field? Let me know, my friend. Let me know. Okay, Danish, hi from Russia. Hi, Danish. Thank you for being here. You're coming to the US. Good for you. When are you coming? I am so glad. Are you a doctor? Yes, 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 Dennis. I definitely fell in love. All right. Well, guys, thank you so much. I wish we all the best. Okay, guys, please continue to support this channel. Continue to be part of this family, okay, guys, because I really want to spread the word of hospice to the world, to as much people as possible. Because think about it. Every one of us, every one of us here watching and listening to my voice, we are either one day going to find ourselves being a patient where we are dying, or being a caregiver where we are taking care of somebody who's dying. Do you understand that? And so therefore, it's important to get a head start. Why not learn as much about death and dying as possible, so that it's not so scary when you are experiencing it? All right, my hospice family. Well, thank you so much for being with me, guys, tonight. All right. Like I said, if you have not done so, Please subscribe, give me a like, okay? Come back, okay? Hit the notification bell so you'll know each time I upload. And of course, I upload videos every single day, guys, okay? Every single day. This is for you. This is for you. You are an educated therapeutic masseuse, health, sports, and facial cognitive into Australia for 1 year. Awesome, awesome, awesome. Oh, thank you, Marina, for sharing. And yes, guy, I'm also on Instagram. Please follow me on Instagram and also on TikTok. Follow me on Instagram and TikTok, all under DunsHospice. All right, guys. Love you. See ya.